I mean, first of all, it's just a fantastic sort of initiative to get everyone together around the world, because we're not going to be able to do this whole linkage between humans and the natural environment unless we all work together, because it's a problem right across the world, developing countries, developed countries. So it's a fantastic opportunity to come here and be part of it, and it's just such an important area. This is probably the most important aspect of getting humans and the environment and getting them working together. Well, we've been doing our own bit of work in the UK, and we've probably made some good progress with government, with the Department of Health. Being both a doctor and working in an environment organisation, I kind of straddle both aspects, and I still see patients, so I can still tell people that I'm a practicing doctor, and that helps with the Department of Health. And what we've found is that they're now pushing physical activity and mental health and using a natural environment as part of the solution. So they've realised now they can't do all of this on their own. Medicines don't do it, operations can't do it all, but actually they need help, and the natural environment is that help. And very recently we've had a big report on health inequalities, which is pretty bad everywhere in the world, and Professor Michael Marmot, who's a kind of big guru on this, has put the natural environment as a fundamental part of getting equality. I've learnt a lot. I mean, we started the Congress yesterday, and just in the first 24 hours, I've learnt a huge amount, and I'm going to continue learning all of the next 5 days. So I'm looking forward to finding out a huge amount of what other people are doing, what other people are thinking, how the developing world particularly are working. And then I think the other thing is going to be working together much more, so that we've got a big research agenda, but that research agenda needs to be coordinated right across the world. We've got policy to go for governments. Well, if we all work together on governments, they haven't got a chance. You know, we've got to go and work together on that. And then we've got to be able to talk to the medics and the health service, who've got the big budgets, to shift it from treatment to prevention. That is a worldwide initiative we've got to do. So that is where I see this Congress. You know, it may be a start, it may take years to do, 10 years, 20 years, but if we don't start now, it'll never happen. It's a really difficult question, which speaker or other part. I don't know at the moment. Gladys from Uganda was inspirational, how she's worked with the local people to help them to understand why it's important to conserve the environment. And Howie Frumpkin from the United States is putting the evidence and showing that we don't need all these highfalutin kind of randomized controlled trials which are used for drugs, but we need a different type of evidence. So there are 2 sessions we've had already. I don't think there's a particular one. I'll be able to answer that question at the end of the sessions. Well, I work both in acute medical care, and I work obviously in government as well. And I think for the acute medical care, it's got to be real to a doctor. So it's got to be real when they're facing a patient. But this is not something miles away in policy land and in the academia, but this is going to affect that patient who's got diabetes or obesity right sitting in front of them, and they'll know what to do. And I think one of the things that Healthy Parks, Healthy People can try and help doctors around the world, but also parks people as well, is what can we actually do? What's the intervention? What's the actual bit that we're going to do to make a difference when that patient is sitting there and needs to have life changed? Well, first of all, we've got to plan the next conference. So we've got to have a sustainability for it for 2 years' time. And I'm hoping we might be able to take that to London, which will coincide with the Olympics and the Olympic Park that's being developed there. So I think having these conferences every 2 years acts as a focal point. But I think there needs to be a very, very strong development with a committee or group who will just keep on pushing at the boundaries. And we've got to make sure that that is active, and it'd be one of the kind of rallying cries, I think, on the Friday when we end, that this will be taken forward, because this is the start, and full marks to Victoria State in actually pushing this forward, and the Parks Victoria for taking it forward. We're on a very kind of probably pivotal point in medicine. We've fantastic results with antibiotics and surgery and medicines over the last 100 years, and we've transformed health from getting rid of all infectious diseases, heart disease, cancers. They've all been dealt with pretty well. We've come to the point now we've got mental health problems, obesity, inactivity, and tablets don't deal with those very well, and operations certainly don't. And the health sector is looking for partners, and one of those partners is the parks. And I think what we will find is that partnership will develop by necessity, not by choice from the health side, by necessity. And over the next, I think it will be 10 years, probably 20, we'll see a transformation in the environment being used for health. But it is going to take time, and we mustn't get impatient. It took 30 years for smoking to come right way through. It's taking about 20 years so far for physical activity, and this will be another 20 to 30 years.